Hi, everyone. Welcome to Geneva and this World Health Organization Africa media briefing. We're going to take questions from across Africa for our guests from WHO, and we're delighted to be joined from Congo-Brazzaville by Dr. Matshidiso Moeti. Apologies for my mangling of name there, who's the WHO Regional Director for Africa. With her in the studio there is Dr. Zabulon Yotti. Her colleague, Dr. Michel Yao, is also going to be online with us. He's joining from another dial-in. We're hoping to have Dr. John Nkengasong, who's the Special Envoy on COVID-19 and directs the Africa Center for Disease Control and Prevention, join us. And we're also delighted to have online Professor Samba Sow, who's the WHO Special Envoy on COVID-19 and the Director of the Center for Vaccine Development in Mali. We have access to your Q&A. Avec moi, mon collègue Peter Vanham, qui parle français couramment, pas comme en anglais. Peter?
Bonjour à tous et à toutes aussi depuis l'Afrique francophone. Mon nom est Peter Vanham et cette conférence de presse se déroulera en anglais mais aussi en français. On entendra plus tard des questions et des réponses en français.
Merci beaucoup, Peter. Okay, Dr. Moeti, can we start by hearing from you in Congo-Brazzaville? And the question top of mind for people here is the number of COVID-19 cases is accelerating in Africa. What does the region have to do to respond from your perspective as regional director?
Yes, thank you. And good morning to you. And good morning also to all our media colleagues who've joined this virtual press conference. It's true that the situation is evolving very quickly in terms of geographic spread and the increase in number of cases in Africa now. Just over a month ago, we only had one country in the WHO Africa region, which is mainly sub-Saharan Africa plus Algeria. And within 2 weeks of that, we had quite a few more countries, over 10 countries reporting 50 cases a day. And in the last half week or so, we have now, up to today, 40 countries already having the virus, and we're reporting 300 new cases a day. So it's been a very dramatic evolution. What is it that we are asking countries to do in the region? First of all, the most important thing is to still work very hard to contain the spread of the virus, meaning governments have to identify the cases, people who are infected, isolate these people to limit their transmitting to others, treat them if they need treatment. Very importantly, trace their contacts, try to find everybody who could have been potentially infected by these people, isolate them too until such a time as it's proved that they have not been infected. And I think as well, countries need to work on this containment while preparing for a possible eventual broader expansion of the virus. This is what we are recommending very strongly. We have seen that governments have put in place some measures of protecting their territory against international travel. These are now a fait accompli in many of our countries. We would like to encourage the governments to put a lot of effort into these public health interventions of stopping transmission within countries. And in the current context now, to establish humanitarian corridors, as we are calling them, to enable essential supplies, essential equipment that is needed for the response to be brought into the countries, and also to allow the movement of essential people, some of the experts that are needed, not only by WHO, but by also some of the other partners that are going to be working with us to support countries to mitigate against the impact of this virus.
Thank you very much. And turning to Mali, and Professor, you're running the Center for Vaccine Development there in Mali. Can you tell us how close we are to having in development a vaccine that'll be available across the continent?
Thank you for the question. And I would like to thank WHO Afro and Global Forum for inviting me to participate into this important press conference. So indeed, the best, the ideal solution would have been to have a vaccine ready and to have a great treatment ready today. But unfortunately, up until now, there is no treatment and no vaccine against this virus. So researchers around the world are working hard on this. And we have many candidate vaccine, more than 20. As of I'm speaking today, probably more than 30 already. So experts are estimating that it could take between a year up to between 12 up to 18 months to develop a vaccine that could be ready for market, which assumes also that the process from the conception of vaccine all the way down to the availability to market will go smoothly without a single issue. So if everything goes well, from 12 months up to 18 months, that will be the fastest, if you are all lucky, for us to have a kind of okay or good vaccine available to us. So this is being monitored. There are trials ongoing. Some have started phase 1, and some are even completed enrollment of participants. So we are waiting for some preliminary results very soon. Thank you.
Thank you very much, Professor. Question from Simon Allison of the Mail and Guardian in South Africa. And Dr. Moeti and your colleagues, let me know who would like to respond on this. Are there any African countries that the WHO is especially worried about in terms of their preparations and response to the pandemic? And maybe perhaps are there countries who are really leading the way in responding? Who wants to take that question? Looking for a signal from Brazzaville, Congo.
Go ahead. Dr. Moeti?
I'm muted.
Go ahead.
Dr. Moeti, can you
Okay.
give us an answer to that one from the Mail and Guardian? And maybe if you want to bring in a couple of your colleague, Dr. Yao or Dr. Zoti, that would be great. Dr. Yoti.
Okay. Yeah, I think as far as countries that have, if you like, worked most effectively to be prepared, I'll start by saying that this work needs political commitment and support and monitoring from the highest level. And we've seen a number of countries, a number of heads of state put in place the mechanism at the most senior level, sometimes shared by the Prime Minister of not only the Minister of Health, but other ministers as well, whose contribution is relevant in countries like Kenya, Ghana, South Africa itself. I was watching last night, a panel of ministers announced to the public on SABC the measures that are being put in place, and they are working together. Countries like Uganda, Ethiopia, in Cote d'Ivoire, in Senegal. So a number of heads of state, Ghana as well, have put in these mechanisms whose role it is to link, if you like, the political commitment and therefore the resources and capacity to make action happen at the highest political level. Quite a few countries have ramped up their capacity to diagnose. We started off with only 2 countries, South Africa and Senegal, with a lab that could diagnose this virus now. We now have 43 or 44 countries have worked very hard with us and with the Africa CDC as a partner to put in place these mechanisms. countries have established point of entry screening. Most countries are doing this now. Surveillance, and some have started putting in place treatment. So I would say, of course, the countries are very diverse in Africa. Some big countries have internal capacity. We need to pay particular attention to the smaller countries which don't have then the technical capacity to do some of these on their own. So some of these might be the small island development states, some of the smaller Southern African countries where we're putting a lot of effort now into making sure that they have put in place the platforms to do this. One of the things I think that is very important for countries to do is to repurpose their technical expertise. So we have many people working in ministries of health who may have a public health background, who may have the kind of social science background that's needed for some of the interventions. What we are doing in WHO, most of our staff are no longer doing their day jobs. We've mobilized them into our team that is supporting the response. I can say that I myself am no longer doing my day job. I'm mostly working on this outbreak. And we suggest very strongly that the ministers of health, other ministers who have a relevant role, pull in their capacities and respond in a very concerted way with all the capacity that they've got in countries in trying to prevent the onward transmission, the expansion, and also to mitigate against some of the key impacts of the virus itself and some of the measures that have been put in place, especially to the most vulnerable people in our societies.
And
Zabilon,
Dr. Moeti, just to pass to your colleague, are there countries where you're particularly concerned about either their ability to respond or what they've done so far or been able to do?
Just to add, thank you for that question. Just to add on to what Dr. Moeti has said, over the last few years, we have observed that the international health regulations capacities have improved on average in all the countries, but we also recognize that there are very significant gaps in all the countries. No country has all the required capacities to adequately respond to this type of pandemic. There are gaps existing in each of the countries. However, I must say that significant improvement over time in some countries, especially those who have been experiencing some of these outbreaks, related outbreaks, where we have systems which have been put in place for coordination, and in most cases it is already multi-sector, for surveillance, for mobilizing in-country and international resources. So we are building on those very existing mechanisms which have already been put in place. There are some specific countries with humanitarian needs. There are countries where we have armed conflicts with massive displacement of population. Also, there are those countries which are receiving refugees. So those ones have special needs. We think a number of countries which are in this group of countries need significant support, and they will be a challenge still to us. This includes not less than 5 countries in our region. Of course, there are countries which have really better capacities, and they are also using those capacities to help others. South Africa being one of them, using the laboratory there to support the other neighbor countries. Senegal and of course Nigeria, using the Nigeria CDC also to support the other neighboring countries as well. Thank you.
Thank you, Dr. Yoti. We have a question from Lagul Joseph, and in a moment, if we can, we'll be going over to Cara Anna in South Africa from the Associated Press. But just wanted to put this question from Canada, from Lagul Joseph at Refugees Deeply, talking about concerns that African countries like Uganda are overcrowded with hundreds of households sharing one water collection point. How exactly is social distancing and self-quarantine going to work in areas like this? What can camps do?
And perhaps Dr. Samba Sow can weigh in from Mali, if we can open his microphone.
Thank you very much. This is a great question. This is a real African, real life, daily, real happening things on ground. I just wanted to, before I go to that question, I wanted to add on to what Dr. Moeti said about country leaders, etc. in mainly in African countries. I also would like to add some of the communication activities and communication at the most peripheral level, community level. Sometimes, even if governments are willing to take decisions, etc., it may not follow necessarily when it gets to community. So a lot of socio-behavioral science and communication and socio-anthropological surveys and sciences to better understand communities will help the high-level policy to move forward. And the same issue will also help with contact tracing and containment. How can you ask a household already with over 60, 100? I know personally households in Mali and in sub-Saharan Africa where you have more than 100 members. My own household, because you cannot be head of household until the first original head, like my dad's dad will die, and then my dad will become a household head. And then my dad then will go, and then if I'm still there, I will replace him. That's the way it is. So you can see a big household with a lot of small households inside. So that way you can have easily 60, 50, 100 people in one house. How can you lock those down? You're actually kind of putting them in jail. That will be a nice media, a nice way for the virus to grow up quickly and kill all of them inside the house. So it's better to actually even let those out to protect them rather than locking them down in a very small space. This is real in Africa. So we all need to think about this aspect. We all need to make sure that we communicate around this, and we all need to make sure that we be creative with much more flexible, innovative, adaptive, according to social and cultural behavior in that given, in those kind of given places. So
thank you, Professor. Wondering if we can bring in, if we have now on the line, Dr. John Nkangazong from WHO, Special Envoy, Director of Africa's Center for Disease Control and Prevention.
Hello.
Just checking this.
Yes, I'm here. Can you hear me?
We can hear you and see you. Thank you. What's your response on that question about the ability of these households to deal with this crisis?
Thank you for the opportunity. I think I agree with Professor Samba. So a perspective on that is something that we continue to think through very carefully. And I don't think there's any easy answer to that. Our communities are what they are. We have to think through the issues of social distances in the context of our own cultural and social livings. As he rightly said, I mean, our households are large. At the same time, we have to recognize that this is an important measure, a public health measure that must be implemented if we have to have a chance to fight back this enemy. So I think it's something that I agree with him entirely, that we need to use all the tools we have, including involving early on our social scientists into this fight. This is not exclusive for any particular group there. So I don't think we know the answer, but we have to work closely with our communities on this.
Thank you. And just a reminder, Celia.
So if I may say something on this, just a word on this. I agree very much with both John and Samba that this is something that needs really deep reflection quickly, because the virus is spreading even as we speak, so that we can adapt the intention of this intervention so that it actually has the result that we would like it to have. I do find that at the moment, in many of the countries, not those with local transmission already, but those with imported cases, we need to carefully consider who is it who is coming into these countries and is importing the cases. I believe in perhaps half of the countries, we still have an opportunity with a type of person who flew in from Europe, because that's how most of the countries have had imported cases, who may be living in a type of place where they can do this kind of social distancing. And this must be very strictly observed. I believe if we succeed here, we may limit the spread, and we must also, of course, be thinking about the type of circumstances in which many lower income families in urban areas, people in refugee camps are living. So we put in place the measures that are adapted for those contexts as well.
I would like to add.
Sure, I appreciate these contributions. I'm very keen that we also get to questions from journalists on the line as well, if we can, because we have a huge number of folks who really want to get your opinions on a whole range of topics. If I can, I just want to bring in Cara Anna from AP in South Africa.
Yeah, I think it's actually Sarah Jerving that's already on the line. Sarah from Nairobi, if we could go to you. Sarah from Nairobi.
Yes, thank you so much. My question is, I'm a journalist with DAVEX. I've heard mixed information about whether individuals living with HIV are more vulnerable to severe cases of COVID-19. Can you clarify whether this is accurate?
Dr. Moeti,
Okay.
could we hear from you?
Yes, I think the answer is that we do not know, but we are concerned that this is a pre-existing condition that could make people more vulnerable to the virus, because in the past it's been observed that there's an association perhaps with influenza as well. So we are sounding the alarm in the region that because we have a relatively high proportion of, in some countries, of people living with HIV, some of whom don't yet have access to treatment and may therefore be immune compromised. This needs to be taken into account in the interventions in countries.
Thank you. And just checking if we have Cara Anna from South Africa on the line.
Hi.
Otherwise, we'll just...
Yeah, we do. Thank you.
Can you hear me?
Yeah, go ahead.
Great, thank you. My question is the number of confirmed coronavirus cases in Africa artificially low because of the shortage of testing capabilities? And if so, what is a more realistic estimate? And if I can tack on another question, also, which countries in Africa do not yet have testing capability? Thanks.
Okay, Dr. Moeti, do you want to start with that for us?
Yes, I will start with that. Indeed, it's true that, as we know, there's a global shortage of testing kits and desperate wish and intention and efforts on the part of many countries to have more of those kits so that they can test cases. So the type of case finding strategy that we would have liked to see is perhaps not happening. However, we do know that there have been hundreds of alerts of people with possible either contacts or symptoms that might be suggestive that have been tested in African countries, and many of them discarded, found not to be positive. So we recognize that there will be people who are asymptomatic and might be infected in African countries, but we don't believe that there is widespread numbers of people undetected, because we have, as I said, we have an influenza surveillance network in more than 23 countries, and it has not reported having observed an uptick in the syndrome that is typical of this disease. So while we acknowledge that there may be some people who are infected, asymptomatic, not tested, and therefore not counted, we don't think that there are hugely increased numbers of people who are walking around infected with the virus who are not detected. Partly because in most of the countries, we are at the phase in half of the countries in the region where we have people who can be identified as having traveled from elsewhere, who then show the symptoms and are the first few cases in these countries. Zabilon, I don't know if you want to add anything on this.
On the availability of labs, maybe.
Yes.
Yes, for the second part of the question, which African countries do not have the capacity to test? We have used the available resources in the region such that countries do share capacities across the border. Initially, like Dr. Moeti had said, we had only 2 labs, and the mechanism was to send all those samples to the 2 labs. But thanks to all the contributions of the partners and the countries themselves to scale this up to 44 labs now available in the region. Our target is for each of the countries to have that capability given the needs now, and we are moving towards that, that target. In doing so, we have collaborated and worked closely with the Africa CDC to ensure that all countries have the reagents which are required. We have also ensured that people are trained to use these reagents and to have testing available in their countries. Almost all the countries now have that capacity, which is based on a complex test called PCR, but there are a couple of countries which need the machine, and we're working towards those countries getting the machines within their own boundaries. So as of now, the testing capacity available is shared along the region. Thank you.
Thanks very much. And just a reminder, if you can use the Q&A function on the chat to put your questions, and then we can put them to the doctors around at the WHO. Peter, you have a question in French, I think.
Oui, effectivement, il y a une question de Falila Gebadamassi qui travaille pour France Info Afrique à Paris. Et il demande, il y a une polémique apparemment autour de l'utilisation de la chloroquine. Il y a des essais en cours déjà, mais il est déjà administré maintenant dans plusieurs pays, dont aussi des pays africains. Qu'est-ce qu'en pensez-vous, Dr Moeti?
Ok, merci. L'OMS, avec d'autres partenaires, nous avons été informés de ce qui se passe concernant l'utilisation de chloroquine. Il y a plusieurs essais qui sont en cours en ce moment-là. Et puis, il y a une équipe au niveau de l'OMS, siège, qui travaille avec des partenaires des institutions qui sont en train de mettre en œuvre ces essais pour étudier l'efficacité ou pas de chloroquine. Jusqu'à maintenant, l'information disponible, c'est-à-dire que in vitro, ça veut dire que dans les conditions de laboratoire, il y avait une suggestion que ça peut être efficace. Mais en ce qui concerne les essais des sujets humains, comment dire, les données sont en train toujours d'être étudiées pour établir si ça peut être recommandé ou pas. Et en ce moment-là, l'OMS n'est pas à mesure de recommander l'utilisation de chloroquine. Il y a une forte pression, nous avons compris au niveau communautaire, au niveau des pays, et il y a déjà quelques personnes qui commencent à utiliser le chloroquine. Jusqu'à maintenant, ce n'est pas recommandé par l'OMS, mais il y a des essais qui sont en cours. Et nous espérons bientôt d'avoir des résultats qui peuvent nous permettre de faire des recommandations.
Merci beaucoup.
So we're getting some questions coming in on the chat function, and maybe put some of them together. Question from Pamela Mawanda. There have been reports from some African countries who've been exposed to COVID-19 from countries not thought to be high risk. Do you think countries are under-declaring confirmed cases, and what does that mean? Question from Tassaya Moga. There's been information around in social media saying that there have been some recoveries already. What are the chances for full recovery from COVID-19? And a question from Malab Nyanaba at Network 24 in South Africa. Concerns regarding reports that COVID-19 is airborne and spread in this manner. Do we know what the risk of reinfection is for those who've already had the virus? So a number of questions really, I think, showing that people want some more information really on both the manner in which it's spread and on how governments are reporting this. Perhaps we can turn to Dr. Nkenga Song at the Center for Disease Control and Prevention. Are you concerned that countries are under-reporting cases, or do you think that we've got in place a good reporting system?
No, thank you. I think countries are reporting the situation as it's evolving. I don't think at all that countries are not deliberately not reporting cases. As Dr. Moeti mentioned, it is very possible that in Africa we are missing cases. That will be very normal. But I think there's the goodwill and a strong political drive and commitment for countries to do the right thing. So I think what we are seeing is it reflects the reality of the situation. Of course, knowing that there are certainly cases that might be out there and we don't know.
Dr. Moeti, from your side, you can hear from one of those questions about concerns about both about the recovery from COVID-19 and also the spread of the disease through the air. Can you just tell some of the journalists listening a little bit more about the nature of the virus, perhaps to reassure them and also their readers and viewers?
Well, yes, there have been people who have recovered from the virus. And I think this is a good question because it's important for people to know that you can recover from this virus. There's a description in countries that have had larger numbers of cases of what types of people have died. And many people have recovered from this virus, and we should fully expect that in Africa too, people will recover from the virus. My colleagues may give the numbers of those who have been documented as having been ill and recovered. It's important for people to realize this. This is indeed a virus that's spread by droplets, so people coughing, sneezing. That's why social or physical distancing is strongly recommended as a way of stopping the disease. But it's also a virus that can be spread from the surfaces where people have touched their nose, mouths, and have it on their fingers. And therefore, that is why hand washing is so strongly recommended as well. So we need to recognize that there are ways to spread it, ways to stop, block the droplet spread, but also the virus may be on particularly on people's hands. So we need to be aware of the need to stop that. I think as for whether people can be reinfected or not, this is something that we need to understand going into the future. But I'll ask Zabulon to respond to that question, perhaps from the experience that we have seen with other coronaviruses.
Thank you. We continue to observe that most of the cases are actually mild, like we have seen in other regions, meaning that the chances of survival recovering are very high. We also know that a small percentage will be having critically ill people, and we're observing that in the region as well. So the fact that some countries are already discharging people from the isolation facilities is in line with that, but also it gives hope to the countries which are reporting cases. The issue of reinfection, we are still learning from this disease. It is a new disease, as we said, but from SARS and MERS, which are similar coronaviruses, these were not very significant in terms of getting people who were infected, getting reinfected again, but we're still learning from this new coronavirus.
Thank you. And Dr. Yao, I know you're on a separate line. If you want to come in on any of these issues, please join in the discussion with us here on the line. We have a question from Simon Allison, who just wants to follow up Dr. Moeti, asking if you thought that half of African countries could avoid a serious outbreak if they take effective measures to prevent the virus being imported from outside. So he's just asking if that's what you meant.
Yes, what I meant is that we have still a window. It's true that it's narrowing every day as the data about the geographic spread to more and more countries tell us. But in about half of the countries, just over half in the region, we still only have imported cases. We have not yet identified that local spread is occurring. So if there is really rigorous and very systematic follow-up identification, as I said, of these cases, isolation of these people, follow-up of the contacts. The follow-up of the contacts is what will really make the difference, and isolation of them too under observation. We still could contain this virus in many countries. What we are seeing is that some of the measures that have been put in place, some of the rather draconian border closures, flight stoppages that have been put in place need to be better accompanied by very strong public health interventions in countries. This is where we need to put most of our effort to really make sure that the capacities are there for daily follow-up of people who are in self-isolation. The public is very well informed and complies with what they need to do to achieve the social distance, the social or physical distancing, and that those people who have been identified as being infected with the virus really are isolated at whatever level. We still have the opportunity to stop this in some countries.
Thank you. Peter, I think we time for a question in French.
Oui, tout à fait. En fait, il y a beaucoup de gens qui se posent cette question, entre autres Abdoul Malik Diallo à Guinée, au Guinée, et aussi Simon Petit du Temps ici en Suisse. Et il demande qu'est-ce que vous pensez des mesures de confinement qui ont été prises par certains pays africains, comme aussi l'Afrique du Sud. Est-il réaliste, en fait, de confiner toute la population d'un pays ou d'une ville comme est le cas au Kinshasa, au Congo? Et peut-être, je vois que le docteur Samasso au Mali voudrait répondre.
Peut-être en français, si vous désirez, non, comme ça a déjà été répondu en anglais.
En français, s'il vous plaît.
Merci. C'est une très bonne question, de très bonnes questions. C'est vrai que la question du confinement, c'est une des meilleures méthodes pour stopper la transmission de personne en personne. Respecter la distance sociale qui a été recommandée par l'OMS est un moyen fort. Et c'est ça qui a permis à la Chine de faire reculer cette maladie, ce virus. Mais bon, il faut reconnaître que dans certains contextes, comme le contexte africain, ceci n'est pas facile. Parce qu'il faut prendre en compte les aspects socioculturels, il faut prendre en compte les aspects économiques. Enfermer les gens toute la journée, des gens qui vivent au jour le jour avec les activités quotidiennes, ce n'est pas facile. Vu le travail agricole, le paysan et le petit commerce, toutes les petits métiers, vraiment le confinement va être très difficile. Mais on a dit qu'il serait bien de réfléchir avec les pays en question et chaque communauté a ses réalités. Et quand on explique et on communique, il serait possible ensemble avec les leaders communautaires, avec les gouvernements, avec les acteurs de santé publique, pour les partenaires, adapter ce confinement et adapter donc ces
Je pense qu'on n'avait pas vraiment entendu la dernière partie de votre réponse. Est-ce qu'il y a peut-être aussi le docteur Yao qui peut nous guider sur cette question aussi? Docteur Yao à Brazzaville.
Merci beaucoup. En fait, la distanciation sociale, c'est une mesure de santé publique. L'objectif, c'est de ralentir la transmission pour se donner les moyens d'un contrôle, pour éviter que les moyens de réponse, notamment les services de santé, soient débordés. Dans le contexte africain, il faut absolument que cela s'accompagne aussi des mesures humanitaires. Et je pense que ces derniers jours, il y a eu une évolution avec le système des Nations Unies qui ont lancé aussi un appel pour les activités humanitaires. Sans ces activités d'accompagnement qu'on observe d'ailleurs dans les pays qui ont des moyens, il est important d'accompagner les plus faibles. Et donc, dans cette réponse-là, il y a bien sûr le coronavirus, mais il faut s'assurer que ces mesures-là n'affectent pas aussi d'autres aspects d'accès aux services de santé qui pourraient peut-être faire accroître les décès liés aussi à d'autres pathologies si les services ne sont pas adéquatement organisés dans ce contexte de confinement qui est une mesure de santé publique assez importante.
Merci beaucoup.
Merci. We have Morgan Windsor from ABC News in London with a question. Says, I recently spoke to a doctor who's treated Ebola patients in Northeast DRC, and he's very concerned about the coronavirus pandemic hitting the region, as it's not yet in the clear from the Ebola epidemic. How concerned are the WHO about the DRC, and how concerned is the African CDC? Perhaps if we can turn to Dr. Moeti and then to Dr. Nkengasong. Dr. Moeti.
Yes, thank you. We've been very concerned that this Ebola outbreak in the DRC doesn't get forgotten in all the concern about the rapidly expanding COVID-19 pandemic. And we have sustained the work that we've been doing with our teams in the DRC. We have been counting down. I believe we're at the 30th. Oh, we're at the 12th day after closure, meaning if we continue to count down to reach 42 days now, we have not had a case after the last case was cured and discharged. We were very concerned that early yesterday, there was a violent attack on responders in a place called Biakato. We are very much, again, on alert to see if there might be any problem arising from this. We are hoping not, because we have not had a case in the past. What used to be the problem would be then that there are people who are still infected with the Ebola virus, and our responders were not able to reach them due to security reasons to then intervene, and then we'd see an uptick of cases. We are very much hoping this will not happen this time, but we are absolutely staying there while looking now to see how some of the many staff and experts that we had mobilized can start to be demobilized. We are keeping a focus on this Ebola virus outbreak in the DRC, and we are keeping a core staff to continue with the surveillance, with the follow-up, and with everything that needs to be done until we reach the 42nd day after the last patient was cured. So, of course, the preparedness for the COVID-19 has to take place everywhere, including in North Kivu and Ituri, and we're working with the government to put in place the measures then, at the same time, to make sure that people are informed about this additional virus. We do think that some of the lessons learned, some of the interventions around the Ebola virus will be assets that will help in this case. Certainly, there are very well-established mechanisms now for talking to people at the community level, mobilizing them even to be part of the surveillance system, for example. And we very much hope that that very painful experience will have something to offer to what the country, with our support and other partners, is doing now to prepare for this COVID-19 outbreak.
Thanks for that, Dr. Moeti. And perhaps we can turn to the Center for Disease Control and ask you, Dr. Nkengasong, what your take is on that epidemic in DRC and how prepared they are for the onslaught of COVID-19.
Thank you. I think we should be pleased that the Ebola outbreak is in the right trajectory, as Dr. Moeti mentioned. We are very encouraged with that. I think in the overall context of what we are dealing with here, the DRC seems to be very unique in this crisis, because they are dealing with two public health emergencies of international concern at the same time. The Ebola outbreak is in the right trajectory, but it's not over. And the COVID-19 is out there as well, and moving pretty quickly in the Congo. So I think the country will be more challenged. We know that there are other outbreaks that the country is dealing with, including a measles outbreak, including polio vaccine-related outbreaks, and cholera and other things there. So the system is challenged and will continue to be heavily challenged. I think our greatest fear is what will happen to DRC, especially in the areas that you just mentioned, if COVID-19 seeds itself into those areas and challenge ability in a significant way, such that you can't even respond using the very fragile system that exists there. So it's everybody's concern. We should be preparing for the worst and expecting the best to happen in the DRC.
Merci beaucoup.
Thank you for that. Question from Arise TV in Nigeria, Ohi Odai. Are you satisfied with Nigeria's response so far to COVID-19, given that there are some 50 cases now in the country? Perhaps I can put that first to Dr. Moeti and your colleagues.
I think I'll give the opportunity to Dr. Yoti and Dr. Yao to respond. They certainly started off excellently well with the Nigeria CDC, which is an institution whose effectiveness has really grown in the last couple of years, not only from the capital, but also to the provincial, to the state level, in a way that we are recommending that other countries do. But Zabulon, perhaps you'd like to come in now and say what is our view of how Nigeria is doing.
We were very happy with the fact that Nigeria was able to pick those first two cases, which were the first case which was imported, and then they meticulously followed all the contacts, and within 14 days, all the contacts were followed properly, monitored, and those who needed to be tested were tested, and none of them developed disease. So we're happy with that. We're also happy that that same capacity is now detecting more cases. The fact that they're reporting 50 cases, we're seeing it as a functional surveillance, which is actually working. And also we are seeing that they're listing the contacts and monitoring very, very regularly. The fact that Nigeria's CDC, together with the government, has taken leadership on this is something we would like really all the countries to emulate. Local ownership, strong local response put by the nationals, supported by the partners. So in other words, we are really trying to see that all countries have that type of capacity.
Merci beaucoup. Et peut-être si on peut aussi demander une question de la part de Xavier Marquet, qui est le rédacteur en chef en fait TV5 Monde. Et sa question est sur la situation en Égypte. Est-ce qu'on sait plus de la situation sanitaire en Égypte? Est-ce qu'on sait est-ce qu'on peut attendre de la situation là-bas? Je peux peut-être demander à au Dr Yao de répondre à cette question si vous pouvez.
Merci. L'Égypte n'est pas ralliée à notre région, mais à travers les informations que nous avons du siège, il y a un système qui est mis en place pour couvrir tous les aspects. Mais c'est un peu lié aussi à la question posée tout à l'heure avec le Nigeria, c'est la densité des populations qui exige qu'en plus des mécanismes de contrôle qui sont en place maintenant, qu'on puisse rapidement anticiper, c'est-à-dire mobiliser davantage d'acteurs qui puissent s'impliquer sur tous les niveaux et s'assurer qu'on puisse décentraliser les capacités au plus vite. Dans ces grands pays, la difficulté, c'est comment en fait bouger la capacité dans les grandes villes, les capitales, vers les régions quand la maladie se propage. Et donc, cela nécessite en fait une collaboration de tous les partenaires pour travailler sur ce mécanisme pour la phase subséquente possible, qui est une phase probable dans ces pays à haute densité et qui reste en fait un risque majeur.
Merci beaucoup. Et une question encore, parce que les gens qui sont là avec nous, ils se posent toujours des questions sur la chloroquine. Si vous pouvez répéter peut-être encore une fois, quelle est la situation avec la chloroquine? Pourquoi on ne peut pas utiliser la chloroquine? Et quel est l'avis de l'OMS là-dessus?
En ce qui concerne la chloroquine fait partie de 4 protocoles qui sont en train d'être testés. Et ceci vise en fait à avoir des données robustes pour pouvoir faire des recommandations formelles de la part de l'OMS. C'est une façon de procéder de façon scientifique basée sur des évidences. Le fait de l'introduire dans le protocole, il s'agit d'un protocole prometteur. C'est la première étape. Et c'est justement sur ces données qui montrent le potentiel du médicament que la plupart des pays, plus ou moins, en fait, c'est de là où est partie la rumeur. Mais pour nous, pour le recommander de façon formelle, il faut absolument qu'on ait suffisamment d'évidence pour mesurer l'avantage d'utiliser la chloroquine par rapport à d'autres, mais aussi en termes d'effets secondaires par rapport à l'indication de coronavirus. Il faut absolument que cela soit consolidé par ces données-là. Donc, c'est à ce stade que nous sommes. Et donc, l'OMS supporte ces protocoles qui sont d'ailleurs en test dans certains pays d'Afrique, notamment l'Afrique du Sud, le Sénégal, si je ne me trompe, et il y a aussi certains pays qui sont intéressés à introduire ce protocole. Donc, à ce stade-ci, il s'agit d'essais médicaux pour avoir plus d'évidence.
Merci beaucoup.
Merci. We have on the line, I think, Corinne Duplessis from South Africa. Corinne, you have a question, I think. Can we just... Can we bring Karine up?
Can you hear me now?
Yeah, we can hear you.
Karine Duplessis, I'm a freelance journalist based in Johannesburg. I have a question about traditional medicines and traditional herbalists, and whether the WHO think that they can be used in the making people aware of preventing and treating the coronavirus.
Dr. Moeti and colleagues, perhaps that's one you could address.
Yes, I think it's a bit similar to the chloroquine. For the moment, we are not able to recommend any traditional medicines because none have been tried out. There haven't been any studies to see what might be efficacious. I think what we can say about collaboration with the traditional health sector would be to work with them so that they are part of the effort to communicate to people. Certainly, they need to be aware of what sort of symptoms and signs might suggest that somebody has this COVID-19 virus infection, so that they link them up with the national system for surveillance, testing, confirming if this is the case or not, and ensuring that they also know what sort of advice to give to their clients or patients in the meantime about social distancing to minimize transmission of the virus from themselves in case that they are infected. So for the moment, this is what I could say. Certainly, if there are any promising products or medicines that might be thought because of links with other coronaviruses, perhaps might be efficacious, we would welcome people coming forward, and then they would need to go through similar types of trials as are being discussed in relation to chloroquine.
Thank you. There's a question from Simon Ateba of Today News Africa, based in Washington, D.C., asking if the pandemic worsens, which countries have the capacity or the manufacturing capability to help produce the equipment that's needed, thinking specifically about ventilators and respirators. Dr. Moeti, perhaps, and also Dr. Nkengasong at the CDC.
Yes, that's a tough question and situation globally, I would say. Of course, the type of countries that have the capacity to produce these types of equipment are Western countries mainly, and some countries in Asia like China and India. So countries with the level of industrialization that would enable them to produce these types of equipments. So of course, there is work already going on with China. We heard a couple of days ago, and we've seen that a Chinese businessman working with the capacity to produce laboratory test kits has made a very generous donation to African countries. So we would need to rely very much on these types of countries that have really strong industrialization and production capacity immediately, urgently, and see if they can manufacture sufficient numbers. This is truly one of the challenges that are being faced. I think it would need to be Western countries, which themselves we know are facing shortages of this type of equipment, and some of the Asian countries that have built up the industrial capacity to produce such items. And I think what I can say here is that we need really a global solidarity so that those countries that don't have the production capacity can also be enabled to import, working with partners, some of these key items that are needed to support their own response to the outbreak.
Dr. Nkengasong, we've seen in some developed economies and even some emerging economies that manufacturing has been repurposed to help make some of these machines that hospitals so badly need. Are you aware of any kind of manufacturing base in Africa where that could be the case?
I think the question from the colleague in Washington is valid. I think that discussion has to start now. It's not a question of if we should wait until it gets worse, the situation gets worse. I just got off the call with the 5 head of states, with the African Union President Chair, Excellency Moussa Faki, with the President of South Africa, Egypt, Mali, Kenya, and the DRC. And that was discussed because in preparation for the engagement with the G20, I strongly encourage them to raise that up with with the leadership of the G20 and find ways to establish that partnership, because we need it, and we will need it, and we need it now. And in Africa, it's as Dr. Moechi mentioned, I don't think we have the capacity yet, but it's a discussion that we have to have now with several countries, maybe it's South Africa, Egypt, Morocco, Tunisia, and others, and have a dialogue as to how we can repurpose certain manufacturing and see what can be done. We will continue to rely on partnerships with China and others, but we see that there's a shortage, including the most advanced countries, the United States and European countries. So I think it's a conversation that needs to start now and start urgently.
Okay, one last question, and please reply either in English or French as you see fit, just so we can get to all of our audience. South Africa goes on lockdown at midnight tonight, and there's a question from Cape Town, South Africa, from the African News Agency, Kelly Turner, who asks which other countries might follow suit across Africa. Dr. Moetti and your colleagues, perhaps you could answer that or begin by answering it.
Well, I think it's difficult to predict, but we've seen more and more countries put in place these measures to minimize the transmission of the virus in various ways. Mainly, we have countries that have closed their borders or stopped flights from countries that they consider to be high risk, or others have closed flights from all countries, in fact, which is why we're emphasizing the issue of humanitarian corridors so that the response does not get compromised. We are seeing more and more countries ask people to self-isolate, carry out the self-isolation or social distancing measures. I think we can expect to see certainly the countries surrounding South Africa put in place similar measures. I know that this has been done in one or two of these countries. Our expectation is that more and more countries will put in place these measures. As I said, I would just like to emphasize, since we are coming to the end, that we recommend strongly that these measures be accompanied by very rigorous implementation of the key public health interventions, so that the contacts, if people are being isolated, certainly the people who are contacts of cases need to be very closely followed up, because they are the ones from whom we expect the high risk of transmission to other people. So I do expect these measures to expand. I expect that the countries will take due account of the impact of the measures, put them on strongly as an interim measure, and monitor to see how they are being followed and what is the impact and the benefit from these measures, because we understood that the unwanted impacts can be significant. In South Africa, I understand they're also putting in place mitigation measures, as a colleague said in the past, to make sure that those people who are vulnerable are not in a very dramatic way negatively impacted by some of what is being implemented.
Merci. Et Dr. Yao, rapidement, peut-être une réponse en français pour nos auditeurs francophones.
Nous pensons qu'au stade où nous sommes, il y a la rigueur dans les interventions en cours, surtout les pays qui ont encore des cas sporadiques. Il faut absolument s'assurer que tous les contacts sont bien listés et suivis, parce que c'est là que viendront d'autres malades. Il faut aussi s'assurer qu'on a une longueur d'avance, c'est-à-dire qu'on se prépare déjà, et donc que les pays puissent déjà commencer à mobiliser le personnel médical et à les former. Il y a aussi le point évoqué dans l'émission qui est la solidarité. Les pays d'Afrique n'ont pas souvent l'industrie nécessaire pour les intrants dont on a besoin, notamment les équipements de protection. Il faut absolument une solidarité pour l'approvisionnement de ces équipements et aussi de ces intrants qui sont nécessaires pour accroître la capacité de prise en charge lorsqu'on passerait à une phase de multiplication ou de transmission au sein des communautés. Donc, cette étape-là a besoin d'aide et la solidarité est nécessaire. Si c'est contrôlé ailleurs qu'en Afrique, on continue d'avoir des cas, cela reste encore un risque au niveau mondial. Donc, la solidarité est nécessaire.
Thank you. Merci beaucoup. Thanks for everyone's questions. I hope we've had a chance to get around to as many of you as possible. A big thank you from here in Geneva to Dr. Moeti, the WHO Regional Director for Africa, to Dr. John Nkengasong, the WHO Special Envoy on COVID-19, who directs the Africa Centers for Disease Control and Prevention, to Professor Samba Sow, Special Envoy and also Director of the Center for Vaccine Development in Mali, and also to Drs. Yoti and Yao for their assistance in answering all of your questions, and here in Geneva to my colleague Peter Vanham for putting those questions in French. From Geneva, from the World Economic Forum, and from all of our friends and colleagues at the World Health Organization, thank you very much, and good afternoon.
Thank you, Madam.
Thank you. Thank you.